Hello students, today we will be studying the gross anatomical features of the colon. Now colon is a part of the large intestine, the second part of large intestine, and it is made up of four parts or four subdivisions, and that is the ascending colon, the transverse colon, descending colon and the sigmoid colon. So today in colon 1 we will be seeing the gross anatomical features of the ascending colon and the transverse colon. Now let us try and identify these three cardinal features of the large intestine. Now what we see here, these are the peritoneal pouches containing the fat which are seen along the outer surface of the large intestine, and these are what are called as the appendices epiploicae. Another feature which is seen here is we can appreciate these longitudinally running bands of muscle. This longitudinal running band is what is called as the tinea coli, and around it the part of the gut wall which is inserted to the tinea coli gets puffed out or sacculated, and that is what we call as sacculations on gross and horstrations on a radiograph. So these are the three cardinal features: the tinea coli, which are seen as three longitudinal bands of smooth muscle fibers, the sacculations, and the appendices epiploicae. These are the unique features seen in the gross anatomical specimen of large intestine. Now what we see here is the specimen of the large intestine. We start from here and see the first part, which is the cecum and the vermiform appendix. Next we see the ascending colon, the right colic flexure or the hepatic flexure, the transverse colon along with attachment of the transverse mesocolon, the left colic flexure or the splenic flexure, the descending colon and the sigmoid colon. These are the parts of the colon along with the cecum and appendix. Now in colon 1 we will be seeing the features of the ascending colon and the transverse colon. Ascending colon measures about 15 centimeters in length and is about 5 centimeters in width. Its extent, it continues upwards from the cecum. This is at the level of the transtubercular plane and extends up to the right colic flexure, where it continues as the transverse colon. The right colic flexure lies about 2.5 centimeters below the transpyloric plane and is about 10 centimeters to the right of the midline of the body. The ascending colon is covered by peritoneum on its anterior surface and on the sides, while the posterior surface is non-peritoneal or is plastered onto the posterior abdominal wall. When we talk of relations of the ascending colon, posteriorly the ascending colon is related to a number of structures: the fascia iliaca covering the right iliopsoas muscle, the iliolumbar ligament, quadratus lumborum muscle, anterior layer of the thoracolumbar fascia, the right fourth lumbar artery, ilioinguinal and iliohypogastric nerves, subcostal vessels and nerve, and the lower pole of the right kidney. When we talk of the arterial supply of the ascending colon, it receives its arterial supply from part of the marginal artery of Drummond, formed by anastomosis of the iliocolic and the right colic branches of the superior mesenteric artery. Now we go on to see the transverse colon. The transverse colon extends from the right colic flexure to the left colic flexure, and it describes a curve with a convexity downwards and forwards. The transverse colon is suspended by a bilaminar fold of peritoneum, which is the transverse mesocolon, from the posterior abdominal wall. The total length of the transverse colon is about 50 centimeters and its width at the right end is about 5 centimeters, while the width at the left end is 3.5 to 4 centimeters. When we talk of parts of the transverse colon, it has three parts: the right colic flexure, the colon proper, and the left colic flexure. The right colic flexure, also known as the hepatic flexure, is seen at the junction of the ascending colon and the transverse colon. It is situated in the right lumbar region, 2.5 centimeters below the transpyloric plane and 10 centimeters to the right of the midline of the body. When we talk of relations of the right colic flexure, anterosuperiorly it is related to or covered by peritoneum, and it's related to the colic impression of the liver. Posteriorly, it is non-peritoneal and is related to the lower pole of the right kidney. Medially, it is related to the second part of duodenum and the fundus of the gallbladder. Now we see the colon proper. This extends from the right colic flexure, forming a U-shaped loop, and goes up to the left colic flexure. It runs between the head of pancreas and the lateral end of the spleen. This loop is suspended from the anterior border of body of pancreas by the transverse mesocolon. When we talk of relations of the colon proper, superiorly from right to left, it is related to the colic impression of the liver, the fundus of the gallbladder, body of gallbladder, greater curvature of stomach, and the lateral end of the spleen along with the tail of pancreas. Inferiorly, it is related to the coils of small intestine. Anteriorly, it is related to layers of the greater omentum and the anterior abdominal wall, while the posterior relations from right to left are the second part of duodenum, the head of pancreas, duodenojejunal flexure, root of mesentery, and coils of jejunum. Now we see the left colic flexure or the splenic flexure lies at the junction of the transverse colon and the descending colon. Situated in the left hypochondriac region, it lies 2 centimeters above the transpyloric plane and lies about 10 centimeters to the left of the midline of the body. The left flexure is more acute, more deeply placed, and at a higher level as compared to the right flexure. The left flexure is suspended from the diaphragm by the phrenico-colic ligament, which passes below the lateral or anterior end of the spleen. When we talk of relations of the left colic flexure, superiorly it is covered by peritoneum and is related to the lateral or anterior end of the spleen and the tail of pancreas. Anteriorly, it is related to the lesser sac which separates it from the stomach, and posteromedially it is related to the lower pole of left kidney, and posterolaterally it is related to the diaphragm. The arterial supply of the entire transverse colon, right 2/3 is supplied by the right and left branches of the middle colic artery, while the left 1/3 is supplied by the ascending branch of the left colic artery. The middle colic is a branch of superior mesenteric artery, while the left colic is a branch of the inferior mesenteric artery. The anastomosis between all these vessels is what is seen as the marginal artery of Drummond. The venous drainage goes into the superior mesenteric vein and the inferior mesenteric vein. Similarly, the lymphatic drainage from the right 2/3 drains into the superior mesenteric lymph nodes, while the left 1/3 drains into the inferior mesenteric lymph nodes. Nerve supply again of the right 2/3, the sympathetic is from the superior mesenteric plexus having preganglionic fibers from T12 to L1, while the parasympathetic comes from both the vagus nerves, whereas for the left 1/3, the sympathetic supply comes from the superior hypogastric plexus carrying preganglionic fibers from L1 and L2, while the parasympathetic comes from the pelvic splanchnic nerves carrying fibers from S2 to S4. Now let us see the features of the transverse mesocolon. This is a broad peritoneal fold, a bilaminar fold which suspends the transverse colon from the posterior abdominal wall. It has got two borders, an anterior border and a posterior border, and it has got two surfaces, antero-superior surface and postero-inferior surface. The anterior border is attached to the posterior surface of the transverse colon, while the posterior border is attached to the anterior border of the body and anterior surface of the head of pancreas. What are the relations of the transverse mesocolon? The antero-superior surface is related to the lesser sac which separates it from the stomach, while the postero-inferior surface is related to the third and fourth parts of duodenum, the duodenojejunal flexure, upper end of root of mesentery and coils of jejunum. What are the contents of the transverse mesocolon? It contains the transverse colon, blood vessels supplying the transverse colon, nerves, lymphatics, loose areolar tissue and fat. Thus, we have seen the features of ascending colon and transverse colon in this section of gross anatomical features of colon 1.